Attention, this is an infomercial for informational and entertainment purposes. The environmental and physical well-being of thousands of people between New Orleans and Baton Rouge are being compromised. The government has not given any effective solutions and cancer is on the loose. I repeat, cancer is on the loose. Petrochemical plants are causing people to develop incurable illnesses through the production of chloroprene. For reference, Cancer Alley is a 100-mile stretch between New Orleans and Baton Rouge where the most petrochemical plants are affecting people living in the surrounding area. There's an increase in cancer, and many people are advocating that Cancer Alley gets removed partially or entirely. The government hasn't done enough, and a lot of people didn't even know that this was going on, and this has been an issue since the 1980s, the late 1980s.
How Cancer Alley affects people. So, Cancer Alley consists of 200 plus chemical, petrochemical, refining, and industrial plants. And you would think with that many plants in one area that the air quality is terrible. Well, it is. It's heavily polluted due to that number of plants, and it can cause major breathing problems for the people nearby. So, a study was done with the use of Geographic Information System, also known as GIS mapping, and it was found that polluting industries are located in the sections of the parish that have the highest percentages of African Americans, the lowest average household income, and the most residents without a high school diploma. So really you can see that it's affecting the people that somewhat live in poverty. And it's somewhat bad because if a family member or someone was to get sick, them having that low income wouldn't be enough to cover the hospital bills, pay for all the insurance and everything else. So really, the only way for them to take action is to connect with larger groups that have expertise, educate the public about the situation, and obtain legal representation so that they can find a solution to keep people safe.
Some of the companies involved in creating Cancer Alley and the ones that are involved in cleaning up. So first we have Formosa Plastics. A major player in the petrochemical industry has been linked to environmental issues in Cancer Alley, particularly in St. James Parish, Louisiana. The company began constructing a massive petrochemical complex in the region, which includes a $9.4 billion ethylene plant, a key component in the production of plastics. Another one is ExxonMobil, a global oil and gas giant, operates multiple facilities in the Gulf Coast region, including refineries and chemical plants in areas adjacent to Cancer Alley in Louisiana. The company is a major contributor to the industrial activity that characterizes this region. Valero Energy Corporation, a prominent refining and marketing company, operates a refinery in St. Charles Parish, Louisiana, contributing to the industrial landscape of Cancer Alley. The company's refinery processes crude oil into various products, including gasoline, diesel, and petrochemicals. Now, some of the companies that are involved in helping to clean up are the Louisiana Department of Environmental Quality, or otherwise known as LDEQ, plays a crucial role in overseeing and regulating environmental issues in Louisiana, including efforts related to the cleanup and um, mitigation of pollution in Cancer Alley. Another company involved is the Environmental Protection Agency, a federal agency in the United States, is involved in overseeing and regulating environmental protection efforts across the country. In the context of Cancer Alley, the EPA may be involved in coordinating cleanup initiatives and enforcing environmental regulations.
Who does this affect and what areas is this problem most significant? The economic standpoint of the cities considered a part of Cancer Alley is closely related to the racial demographic reported by numerous sources. Cancer Alley's 100-mile stretch from New Orleans to Baton Rouge affects many high-populated parishes, including St. James, St. Charles, and John the Baptist. The demographic of African American individuals living near the petrochemical plants of Cancer Alley are significantly more affected compared to other races financially, environmentally, and socially. According to ProPublica, an investigative news outlet, Cancer Alley's annual per capita income is $15,000. This is notably lower than the state's average income by 1/3. Indication of environmental racism is apparent, which can be defined as discrimination in laws and regulations that leaves a minority of individuals in unsafe living conditions. The U.S. Environmental Protection Agency released a shocking demographic titled Wanting to Die, revealing 81% of the black population near the infamous Dinka Dew Point plant, which affects the St. John the Baptist parish. After numerous complaints from the EPA, residents, and other county government officials, the U.S. Justice Department filed a lawsuit on behalf of the EPA after previously dismissing the complaints and justifying the plants through the avocation of workers' rights. They claimed that the 200 petrochemical plants responsible for the pollution of the surrounding area provided thousands of residents with work jobs. Ironically, only 28% of African American population in this area works in the manufacturing field, based on the Tulane University study, which further proves environmental racism. Lack of funding, media coverage, and awareness has delayed previous research initiatives taken to reduce the risk of cancer caused by petrochemical plants.
Louisiana had the second highest state cancer death ranking in 2001. Due to these petrochemical plants found along the Mississippi River, mortality studies conducted in 20 parishes show that people living in Cancer Alley who get their drinking water from the Mississippi River have a 2.1 times higher chance to develop rectal cancer. Also due to the plants, Louisiana cancer rates are higher in or downstream from Cancer Alley. A different study also showed residents who live within a mile of a chemical facility have a 4.5 times greater chance of developing lung cancer. Elevated rates of cancer, skin inflammation, major breathing problems, and other health risks have been described by those that live in Cancer Alley. Some possible solutions for fixing Cancer Alley include extremely high fines and revocations of permits and licenses necessary for companies that produce a dangerous amount of chemical pollution or companies that harm the community around them or the environment around them. This revocation would last until the problems were solved, and the fines would increase every day until they shut down or fix the problem.